certainly it is always helpful to talk about what is a waiver. So the waiver serves financially eligible individuals who, without the benefit of waiver services, would be institutionalized in a hospital or a nursing facility. And the waiver allows us at the state to be excused from certain Medicaid rules and to cover home and community-based services under Medicaid funds, which normally would not be the case. And is providing individuals with Medicaid coverage, which they might also not be eligible for if they were not on a waiver program. And what is a personal care attendant? And sometimes it's personal care assistant. Those terms are interchangeable. The primary role is to fill in the gaps so that an individual can achieve the highest level of independence and socialization in the community. The PCA is not a licensed professional caregiver, and they provide personalized service. They can assist with hands-on care. They can assist with opening and reading mail, paying bills, being an escort, as well as making light meals. And under the PCA waiver, it allows individuals to direct their own care and supervise their employees. Next slide, please. So the personal care attendant waiver, the primary goal is to assist individuals with achieving the highest level of independence and socialization in the community. We know these are individuals that might otherwise be institutionalized in a hospital or a nursing home setting. And the goal is to provide an alternative to entering an institution and provide them with greater independence in a community setting and to be successful in the community. Next slide, please. So who's eligible? You must be an individual between the age of 18 and 64. You must have a long-term health condition that requires hands-on care with at least 2 activities of daily living. You need to lack family and community support to meet those above needs. You have some financial eligibility requirements that you need to meet. And you need to be able to supervise the personal care attendant or have a conservator who can do so for you. So that's an important piece of this particular waiver is that you are the employer of your staff. And so you need to be able to manage that or have a conservator who would be able to step in and manage that piece for you. Otherwise, this is not going to be successful. Next slide, please. So what are the functional eligibility requirements? We've mentioned they have to have a long-term health condition and they need to have a need for hands-on care with at least 2 activities of daily living. And those we're looking at bathing, dressing, toileting, incontinence care, eating, or transferring. Next slide, please. So financial eligibility requirements. So they must be able to qualify for Medicaid coverage. There's no state funded option for this waiver. So we do have some waivers that are only funded by the state. That's not the case with this particular waiver. Their assets cannot exceed $1,600 and counted assets are bank accounts, some life insurance policies if they have a cash value, savings, bonds, as well as stocks. The house that the person lives in does not count as an asset or a motor vehicle that they're using for transportation to employment or ongoing medical treatment, or vehicles that were modified for operation by or transportation of a disabled person. So just of note is that individuals must have qualified for Medicaid by the time they start to receive services. They don't have to be within the financial limits of Medicaid while on the waiting list for PCA. But they must have applied and qualified by the time their name comes up on the waiting list. The referral process, to be referred to the PCA waiver, individuals can either call the 1-800 number, which is the number to the Community Options Unit, and option 8 is dedicated specifically to the PCA waiver program, which is actually a new number for us. It used to sort of be lumped in under some of the other programs. So it's nice that we have this clear designation. You can apply online. And there's also form W-982, which is a PCA request for referral. That form can be mailed and it can also be faxed. And it goes through some of those questions, functional and financial questions to determine some initial eligibility for the program. Next slide, please. So what happens after the referral is made? When making a referral, individuals should be prepared with information about the applicant's needs, their health conditions, and financial information. A nurse or a social worker at Community Options takes all the information and determines if the person appears eligible. And of course, this is just going based upon what's been presented through that form or through the conversation. If the person is eligible, their name will be placed on the waiting list. So that is one of the probably unfortunate things with the PCA waiver is because it's one of the very few that are providing services to those under the age of 65, there is a wait list. We are currently taking people off of the wait list that are from 2018, 2019. So that is certainly concerning. We certainly wish we had more waiver slots. We are serving a little over, I believe it's 1,000 people at this point on the waiver between those that are currently being served and those are somewhere in that pending process that are either going through their functional or financial eligibility determination. But date of application is when you sort of get your slot on the waiver. So certainly we encourage people to go through that process and get their name on there. So they're placed on the waiting list once they've been initially determined to be eligible by the Community Options staff, and available slots are filled in the order that the referrals are received. However, the eligibility criteria must be met. So it's not like you just call and say you want to be put on the waiting list. You do have to answer those screening questions that determine that initial functional and financial eligibility. Next slide, please. So next steps after a spot on the waiting list becomes available. So you are contacted that you have come up on the waiting list, and we want to certainly make sure that the information that was presented is certainly still active. So at that point, a referral is made to one of the access agencies, so Connecticut Community Care, South Central, Southwestern, or Western Connecticut Agency on Aging. And they're the ones that complete the assessments for the program. So they're acting on behalf of the department to complete the assessment of home and community-based services. They explain how the program works and complete all the necessary paperwork. The applicant and the care manager develop a person-centered care plan to meet that individual's needs, taking into consideration what their hands-on care needs are and what they would need to be successful in living in the community. If the care plan is within the cost limits, which is 100% of the average Medicaid cost of a nursing home, the care manager offers the option of receiving services from the PCA waiver once they're determined to be financially and functionally eligible for the program. That paperwork gets sent over to the Community Options Unit, who makes the final determination for eligibility. And there could be some outstanding financial eligibility, questions. So the approval process for that, really varies depending on where the person might be exactly with the process. All plans are initial plans until reviewed and approved by Community Options. So the state of Connecticut has the final say, and that's important to know because we're the ones that are administering this waiver, in conjunction with the federal government. So we are reviewing everything that the access agency is completing to make sure that the person meets both functional and financial eligibility. The next slide, please. So after eligibility is determined, they are eligible for all Medicaid covered services because of course they're getting Medicaid along with this. The care plan is finalized with the care manager from the access agency and services may begin. Services include PCA, case management, and adult family living. Recipients of the PCA waiver, as I mentioned before, they're employers of the PCA. So they negotiate with the personal care assistants to determine the wages that are paid. They're given a maximum rate. It can't go, above X amount of dollars. And generally these rates are less than what is charged by an agency. So it often is allowing the person to have more services than they would if they went through a traditional program, because of course, the agency is charging their price, which includes their overhead costs. Whereas in this case, you're working directly with the PCA, and so your rate negotiated is certainly less than that. The program participants are responsible for hiring and training supervising, as well as unfortunately terminating PCAs if it's not working out for them. They submit the timesheets to a fiscal agency, which then manages the paychecks, and the fiscal agency is responsible for all tax matters. So at least you have, the fiscal agency is managing all those pieces. So the individual doesn't have to worry about that, but they're just responsible for, hiring, interviewing, hiring, training, and certainly counseling their PCAs if something is not meeting their expectations. Allied Health is the fiscal intermediary that is assisting with that process. And so after everything has been approved, they would be forwarded to Allied, who would then help to get them set up as being, an employer. Just a side note on adult family living, it's for individuals who live in a home with a primary caretaker who furnishes personal care and supportive services, such as those homemaker, chore, attendant, meal preparation. Primary caregivers can be a relative, but may not be a legally liable relative. So a spouse would not be eligible to be a PCA. Services include 24-hour response to meet scheduled and unpredictable resident needs. Next slide, please. I've mentioned community first choice at this point because individuals can also be on community first choice with the PCA waiver. So this program was launched in 2015. It's still a demonstration in the demonstration phase. So for us, that means we're normally in community options unit, we have two components. One is the operation side and one is the strategy side. So strategy is kind of rolling out those new programs and initiatives, and they kind of hold on to it initially to make sure that all the little bugs are worked out. And then it transitions over to my team on the operations side to administer. So right now, community first choice is still sort of sitting with the strategy team. It enables Medicaid members who require nursing facility or other institutional level of care to self-direct their services under individual budgets with the support of Allied. They need to be eligible for Medicaid. That includes nursing facility services and have income below 150% of the federal poverty limit. They must, if they're participating in community first choice, meet all waiver requirements and receive at least one waiver service per month. So case management is often enough. And the case management is, a good person to make sure that all needs are being met, that the plan is being carried out, to help the person to be successful in the community. Community First Choice offers some additional services such as support and planning coaches, health coaches, home delivered meals, environmental accessibility modifications, the emergency response system, and assistive technology. So Community First Choice is not just for individuals on the PCA waiver. There are other folks that are eligible for Community First Choice, but it can be a component of the PCA waiver attendant program. And I did put a link as well as, calling 211 and choosing option 3 to get more information about community first choice. And the next slide, please. Link for the PCA waiver, as well as all of the waivers that Community Options administers. And the last slide is just my contact information, as well as the Community Options unit. I ran through that pretty quickly. Any questions?
Thank you so much, Jennifer.
Oh, you're welcome. You're welcome.
Yep.
Oh, I got a question. This is Chris. Hi there. Yeah, thank you for the presentation. But the question is, so this program is only for people between the ages of 18 and 64, is that correct?
That's correct. The PCA waiver specifically is 18 to 64, yes.
Now, I know I'm dating myself, but years ago, I got this program from my grandmother. It was, at that point, called the PCA program. I talked to Edith Craig about it, and it was for someone much older. So is there another program for older adults?
There is, you have the Connecticut home care program for elders. You do have this Community First Choice as an option as well. for those over the age of 65. So those over
Okay, just
65 can also have PCAs. And there are two components to PCAs. So there are PCAs where you self-direct, and then there are PCAs, through an agency. So somebody on the home care program might have a PCA, but that would be, through an agency.
Oh, okay, yeah, okay, I'm understanding. Thank you.
You're welcome. Yes, the wait list is very long. So we are currently working on people that are on the waiting list they applied probably back in late 2018, early 2019. So for this particular waiver, the waiting list is very long. Somebody had asked in the chat if it was long, and unfortunately it still is. There are not sufficient slots for those that need assistance, unfortunately. You're welcome.
Does anyone else have any questions? All right. Thank you so much for your time, Jennifer. I really appreciate it.
My pleasure. I certainly reach out if anybody has any particular questions or if there's something else I can help with related to a waiver.
Okay. Great.
Thank you.
Have a great day. Thank you.
Thank you.
Bye-bye.